That's okay. That's the sound. When is it playing, right?
Far as I know. She was,
What's that?
I said she reached out to both of us prior to this meeting, because she was worried about quorum, because she's getting hard on city council tonight too.
Yeah, and I counted this morning and I thought we were one. We were okay one way, but as long as, but I was Kenny Johnson, so.
Yeah. So we had a question, is there follow-up on the issue that the Board of Supervisors state regarding the requirement to have transport for emergency crisis?
I just kind of, that's kind of bad. I mean,
We talked about last time
right,
that it was something the Board of Supervisors would need to do, but it wouldn't be already that we.
oh, no, yeah, so there was a letter that was sent, we approved it last meeting.
So there was a letter.
Yeah, the
Yeah,
letter
there
was,
was
the letter was in, yeah, the letter was in the packet.
Okay, so that when that
Yes,
was in the
sorry,
packet,
yes.
did get approved, and
It
it
did
did go to the
get
Board of
approved. That was
Supervisors.
choosable. That was letter to the Board of Supervisor to ask them to.
Yeah, is there any follow-up on that?
We could ask them.
Okay.
But it's not like they generally,
Any information about it?
so we can, so we would just ask them.
Okay.
Yeah.
Like I said, I didn't know where that would fall on the agenda.
Yeah, no, it could be,
Probably the supervisor's report.
supervisor's report, you could make some questions. Okay. Yeah, or even, David, if you want, even under, member report out, if you wanted to, also we could certainly do that too.
Okay, I just,
No, I appreciate that.
where in the agenda it would fall.
Yeah, I think, my guess is just. Yeah.
Sure.
Yeah, they just wish for them, for it suspended, they didn't go into what the process would be, I think,
Okay,
so, and.
All right.
Okay, so we can start doing the.
Yeah, we do need one to approve the minutes. And to approve the agenda.
Mm-hmm.
Oh, wait, but we don't, since we don't vote on the agenda, do we need a quorum for that?
If you're going to do any actionable items, you have to have quorum, and that includes approving the agenda.
Okay.
Could you remember it?
Oh, is that Christie?
Yeah, Christie, she's. Hi, Christie. All right, well, we can just go to we can go to the chair report. We do need to vote on the virtual, so I'll hold that until we have a quorum. I can certainly speak to it now because Jonathan's already aware of it, so we can, there he is.
Oh, good. Now we are.
All right. Okay, so we're gonna adjourn the meeting, or adjourn, or the meeting. We're gonna start the meeting. Okay. Do I have a motion to approve the agenda? Second. All in favor? Any abstaining? And approval of the minutes?
Can we make a spelling correction first incident? The comment where Marilyn Boyle, Moyle.
You bet. I'll fix that.
Do you have a motion to approve the minutes?
So moved.
Second.
All in favor?
Aye.
Okay. So moved. Okay. We're gonna go to public comment. I know there's some folks on Zoom. I just want to let everybody know that there are multiple opportunities for public comment throughout the agenda. We like to keep people to 2 minutes, but it depends on how lengthy our agenda is. And we'd just like to remind everybody for the Brown Act, if anything brought up in the public comment that is not already on, it's not already on the agenda, then we would need to put in questions for presentation for a future agenda item. And I think that's That's it. So I'll open it up to online if there's any public comment from online. Okay. All right. I'm gonna start with, I don't know, there was a SB 707, there was a revision, and that is part of the Brown Act that leads to many things, but one of them is virtual participation. And there was some amendments to, many of the changes that were impacted because of COVID that allowed virtual participation were sunsetting. And so what the legislature did is pass a resolution that kept many of those resolutions in place until July of 2026. And what happens is the Board of Supervisors would need to determine which of any of their commissions or committees would be able to allow for virtual participation. And they voted on that at their last meeting, and the local behavioral health board is on that list. So what we would need to do is approve that we were going to adopt that extension for virtual for our members. The meeting still has to be in person, still has to be posted. Really nothing changes from that perspective. It just really expands the definition of what is considered reason to participate virtually. I haven't got confirmation unless you did, Christina, around a quorum, that if the quorum, if you can, virtual members can be part of it, to be counted as the quorum, part of the quorum.
They are part of the quorum.
They are, okay,
Yeah.
that is different. You had to verify they were in the county before to be able to count them.
That they were
Yeah,
actually in the county,
Yeah.
not like on vacation somewhere.
right.
Oh, okay, I'll have to look into that.
Yeah, so, anyway, so, if we want to, we would just adopt a resolution that would, basically say we are going to, extend and consider allowing virtual participation for board members where it meets the criteria that's spelled out in front. Okay.
Just a curiosity question, what is the enhancement about participating virtually from within the county as opposed to participating virtually from anywhere?
I think it has to do with quorum and can you vote? If you're not in the county, can you vote? You voting member. I think that was, what I was told last time is that we had to make sure people were in the county, and if they were virtual, we counted as part of the quorum. And I think it's because the meetings have to be take place in the county, right? And so if you're virtual, all over, I think there's a requirement that people are living in the county.
Well, living in the
Yeah,
county
so I think
is a
that's
different
why.
thing from voting one night. from
Yeah, I get it. I
another
don't,
vote.
yeah, I get it. I don't know that it's logical. It's just, that's, the way
In
it
the new
is.
procedure, we don't have, they have to be in the county. Or is that-
I mean, it's probably the forum. Yeah, I'm validating that with county council, but I believe that is what, when I was reading it today, that is spelled out, that you still need to be in the county, you still have to be on camera. You still have to validate that there isn't anybody under or over 18 in the room unless they identify themselves. I mean, those things still count. So I would assume that you still have to be in the county to be counted as part of the forum. So nice of someone to participate on vacation, but maybe don't bother because, like it's nice to do that, but
There was exceptions with business trips, so you can be out there on a business trip.
you could attend, but could you vote?
Okay.
A whole nother story,
Okay.
I
right?
thought you could.
Again, waiting for confirmation from Bill, so I don't know that, we can certainly clarify that. I can send that via email once I get something.
And we're not meeting in Toronto, right? So
We don't meet in August.
we don't meet in August.
August and November are typically. Yeah, so it's just whether or not we would like to adopt the ability with the expanded definitions for members to be able to participate virtually.
So you say we have to now approve it?
We, as yes, this
Because
board.
I
have
thought
to
we were the
adopt it.
ones, we had to initially start this by asking the board to approve it and include us. And so I thought we already kind of decided at a prior meeting that this is what we wanted and we threw our name in the hat or something with the board. So they would then do their thing and allow us to do it.
I couldn't find anything in any minutes when we actually approved.
Didn't we just ask them?
We
to do
asked
it?
them to do
Yeah.
it, we have to approve
We
it.
asked them to do it.
Right, we asked them to do it.
We have to approve it. We have to have an official vote and approve it.
Hey, could I jump in and give you a little
Oh.
update?
Thank you, Tara.
Sorry. So it's great that you asked the board to approve it. So there is a process, and I can pull up the staff report of the guidelines to send it to you. So you're right. The board has to authorize committees to be able to use this new Brown Act rule. And then the Brown Act rule, the new SB 707 has all these criteria, right? And one of the criteria is that the body, you, need to do a formal vote and affirm after the board has approved you to do this, right? So that's why it's the sequencing. I apologize, you have to do it again to say, yes, we're willing to do this. And something has to happen every 6 months. I can't recall off the top of my head whether it's you have to redo it or if the board has to reaffirm it. But frankly, this is just a formality at this point. So sorry.
I think the board has to, but it went for a year, so I'm not sure, but yes, but I couldn't even find the minutes where we approved it. And maybe we didn't approve it because we couldn't approve it until the board of supervisors approved it. So do I have a motion?
Make a motion, we be permitted to meet virtually, in accordance with the board of supervisors permission.
Second.
Is that gonna work for you?
Yep, perfect.
All right, all in favor?
I need a second.
Oh, sorry, I thought we got a second.
Kingsley.
Has a second?
Sure.
Thanks. One of them over there. One of them over, they did a second. Okay. All right, great. And then long range planning. Really, I just, it's hard to believe it's been a year already. Last year around this time, we were looking at, we had probably 2 years ago, when it's not community members, about 2 years ago, we had a session where we ranked issues, things that we wanted to know more about, and we had a whole wall full of them. And it was great to kind of get a perspective of where, or the direction that the board might want to go as far as learning more about housing, crisis services, children's services, anything like that. And it was a great exercise. The challenge is in determining, okay, who do we get to present? What does it really mean when we have interest in crisis services? So it was a nice start, but it didn't necessarily give us a lot of direction and perspective who we should bring in to speak to the board and what the board might want to hear about in more detail. So this year we knew we had to do the annual report. So we basically, the executive committee made a lot of decisions on trying to get, information on crisis services. We took that and we tried to the best we could fill in presenters and education the best we could based on that initial feedback. So we did our first annual report. Now, as you're working on the annual report, you don't want your annual report to drive your agenda, but you do want to make sure that we have enough information coming to the board so that we feel confident in where we want our annual report to go. So that started back to the question of, do we have a planning session with everybody? And then also what happened is that really the executive committee working on the agenda really then becomes a standing committee. And that's not operationally feasible for many different reasons. So we started, Christina gave us the option of what we've done before is put it on the end of the agenda. And so all of us would decide the agenda planning for the next meeting. But we never really talked about that. So I thought I'd bring that up to everybody and say, we're starting a new year next month. How would the board like to proceed with really determining what we put on the agenda? There's been suggestions of an ad hoc, I'm fine with that, or do we, look at saying, here are the things that we already have been discussing, and then have members throw out at the end of the meeting things that they would like to have in the future. And then we would have an annual calendar that we could throw them out there and say, okay, we heard about FSP, so let's put FSP in November. Let's put this in, and then that would allow us to try to find presenters or people to bring to that meeting what you guys want to talk about. It's fluid, it's not set in stone, and it would also be public facing. So it'd be very transparent about what we're looking at and when we're thinking about having those discussions. Again, these are just discussions, presentations, it's not recommendations. So I just want to be clear, it doesn't mean just because we put FSP for October that we were looking to make a recommendation about FSP in that time frame. So that's a lot, but I thought I would just open it up and see what you guys would, what direction you guys would like to go. Give it a try for a little bit on having us try to do agenda planning or have an ad hoc committee that might come back with some more concise framework around how we might want to do this.
I would appreciate a more scaffolded choice because like, quite honestly, I don't have the institutional memory that you do. So I feel like I'd be taking a shot in the dark on anything.
Mhm.
I'd love to know kind of like what your experience has been over the last like couple of years. And like if we found like, has there been a good mix that you found? Like that has, I mean, what's some of the group's experience been? Would be my question on the long-term planning calendars for fiscal year 2023 and 24 and 24 and 25.
Yeah, I can speak to last year. I can't speak to historically, and then there was COVID. So I think the challenge was COVID changed things a lot. And, Jonathan did a great job really great as a executive committee, finding presenters that were relevant to things that we were interested in. So what I can offer, it is challenging to find people to present in short notice. So for instance, if we knew we wanted to talk about X, Y, and Z, the more notice we have, we can really determine, okay, what presentation do we want and who's best to present that. And so I think the long range planning might help with that a little bit more. I don't know that it'll address your other question about, how does the board decide that they want to prioritize that? Because there's so much out there that we could actually have presented to us. So really, how do we determine what the priorities are? And I don't have a great answer for that. I don't know if Jonathan or Sue, you guys want to weigh in on that with your historical perspective.
Sure. Yeah.
Yeah, I just think that my frustration in the past was sometimes was that it felt like sometimes we were losing time because, we were trying to put things together and, as they came up. And so it sometimes felt like we didn't quite get back to the things that we wanted to talk about. I don't know if I'm putting that very well, but getting around that would be important.
Yeah.
Did you guys see like, maybe like if we did some kind of poll or kind of like was it lack of input at the front end or just changing evolution of the circumstances as the year went and kind of priorities or like, is there any kind of lessons learned?
Well, we did that whole planning process and then we didn't get to like 2/3 of the list. So, I mean, that's a lot.
It's a lot.
Yeah, I think it's easy to forget how few meetings we have and there's so many meetings where we have to get something done that we really have to be strategic to get anything done, really.
Right.
Yeah, and we really pivoted into having ad hocs do a lot of the work, which is not uncommon, right? And I think that's been great. A lot of passion out there. So, if we had the same exercise, would we then have said, okay, well, do we create ad hocs around some of these and let the ad hoc committees come back with recommendation on who they suggest present and when and all those things. But yeah,
I think with the ad hoc committee, if a member has an interest in the presentation in a certain area, if you contact them on the ad hoc committee, can include this. And for example, now that we're behavioral health, we have drug treatment as part of what we're looking at. So maybe medication assisted treatment, what is that? It's on the was available in Yolo County for medication assisted treatment. Just throwing that out as an idea, but it's something that we should be familiar with how it operates. And there are some contracted providers in Yolo County that provide services, but we probably all have particular things that are more interest to us than others. I think the Constitution, how they change membership for the board, there's a big focus on education. And so maybe get a presentation on that. How's that in mental health services in the schools? How does that work? Who would present on that? I don't know, but just kind of ideas. We all can give an idea for what we'd like to learn more about.
But you're suggesting doing that with one ad hoc.
With one ad hoc committee,
How would you keep that from becoming standard?
you would appoint the ad hoc committee for a period of time. I think we could do 6 months, have an ad hoc committee for planning purposes. And kind of come up with a draft long-term plan if we can. And then shift it to a new one. They can always modify or extend that long-term plan, what we would want to do with the meetings. And we would take input. If there's something you want to learn about, if you want a presentation, you did a site visit of Safe Harbor. If you want a presentation from someone there, we can see if we can put that on the agenda for planning purposes. And then get someone to come do that presentation. If you want a presentation from another facility, and someone through 3D North, that's the rock facility with the memorial. But we have that ability to try and get someone to present and try and meet the member. Just need to get, I think, some feedback from members about what do they want to get more information on. Otherwise, you have a small group. I know Meg, Jonathan, and Sue, and Kimberly will be doing a lot of that on their own. But if we have a standing committee, we would try and get other people to give input.
I apologize for interrupting. My only concern with the doing a suggested time frame is that it really needs to be a more specific topic for your ad hoc. So so you want to stick to one thing, like maybe you design your ad hoc just to determine what ideas or things that you'd like to plan for the year, and that be your ad hoc, and the next one can be working on the people who are going to be attending to present to you. So it needs to be more like specific instead of just, we have 6 months to decide what we want to do, because then that would be more of a standing
So
committee.
you have to separate putting together the calendar.
I would just be
and
very
actually deciding.
specific for what that ad hoc is created for,
So if you had it to,
instead of just a general, could be anything at 6 months.
well, just, you have to word it so that the ad hoc committee for the next 6 months will plan and schedule presentations for the local behavioral health board. And if you have it for the next 12 months or so, that way you can,
I don't think you have to put a time on it, it's just that when you start your
the ad hoc committee.
project, it starts and it ends.
Yeah,
This ad hoc closes.
and one of the things is either it starts and ends for a period of time or for particular topics.
Yeah.
Like we wrote the bylaws and that thing went into perpetuity, it felt like.
Yeah.
But the ending point was
Yeah.
the bylaws get approved by the board, or you have something that has a start date and an end date for a particular purpose. And when that end date comes, the committee is disbanded and another one can be appointed.
Okay.
I think that's my understanding of that's how we wrote the bylaws when we did the research on it.
But something I just wanted to bring up, so I had a list, I think from a year or two ago, of topics that were brought up, and I think these are like common themes that people wanted to hear more about. So I'm just gonna read it out, because I have the list here.
Sorry, this isn't about deciding.
Okay,
So we want process.
Okay,
Sorry.
okay. Yeah,
So, because those themes are great, but we're trying to figure out how do we then create a process around those things
okay.
versus, I don't know that I'm asking if we could, agreeing on the themes right now, we could do that, but that's
Yeah.
not appropriate.
I'm just kind of providing like context about
Okay.
what people have talked about in the past. So Crisis Now, Children's Mental Health, FSP, Hope Cooperative, Mental Health Court, addressing community stigma, coordination between agencies, Public Guardian, applying for grant funding, data, and then substance use and consumer involvement. Those are topics that were previously brought up.
Yeah, so those are all really wide. Thank you. That was brilliant. Thank you. Makes sense. So, yeah, so those are all very broad topics, right, for the most part, or they have a lot of complexity within the topic. FSP is very complex. So if we want to, and also to help Tony ensure, another thing that we've done and Tony's been really good about is really in short notice asking staff, county staff to present. And so if there was a way where we could give people a little bit more runway, it might be, I think, appreciated. So that we're not asking them to put stuff together in short notice on top of everything else that they have going. So I think that's
We also recognize that there are times when where a subject comes up. And
Right,
so
and-
we're happy to accommodate.
and I think, you know, again, being fluid and nimble is the same, you know, if something comes up, we can certainly.
Oh, no, it just seemed to me like it made sense to do it as one ad hoc committee, setting up the calendar. And then if we want to have a presentation, well, if we had talked about it, a presentation on housing, then you would set up another ad hoc committee to figure out, well, who is it that we need to hear from on housing? And that would be a separate ad hoc, and then the next topic you would do the next.
That sounds overly complicated. If we
Doesn't
do it, yeah.
This
You
is a little.
you can just do it in one ad hoc committee for a period of time to identify and schedule topics.
Yeah, but what I'm saying is then you've got an ad hoc that's actually looking into the topic of housing. And, you know, they might not even necessarily have to have a presentation here. It might be that they gather up all the information and report back to us after listening to all these different people. If we're saying we want to cover a topic at each meeting, then they can go out and do the research and bring it back, and then also do the research to find out, oh, we need to panel these 3 people, so let's do that.
And it also wouldn't necessarily require that they come out of Tony's office. They could come
Right.
all around.
I was just thinking that if you wanted a committee to investigate or look at different housing options in different cities, that's one thing. But coming back with a report or information, but looking into the long-term planning schedule for what slots we need to.
Right, yeah, no, that's what I'm
Just
saying though, you would have one
Okay.
committee that would actually do, you know,
I think we're
at
saying
each
the same
meeting,
thing.
we're talking about like children's mental health, and so then they would have an ad hoc that would then go gather all the information. on
I
children's
think we're saying the same thing differently.
Okay. Oh,
Excuse me.
okay.
You could just hold it like we did when Brittany came that day. Have it on the agenda to discuss your planning for the year. Take a look at the months that are ahead of us. Get an idea of the topics that are really important in the community right now and that are important to you as a board, and really just lay them out in one meeting with everyone present, and then sort of pencil them in. And then you're not extending it out a long period of time. We know in July, we're going to reach out to this person, and then it gives us an opportunity to look at the calendar, and Tony's team or whoever we're reaching out to will have an idea for the rest of the year of who is potentially going to be coming. And then you don't have to extend it out to a bunch of ad hocs, and unless you need to do that, we could just do it all in one meeting, lay it out on a sheet of paper like Brittany did, and just sort of pencil it out and calendar for the year
Kind of like
in one meeting.
backwards mapping the whole
Yeah.
thing.
And then you can work on it if you add in it, just.
But if we, oh, sorry.
No, I guess I'm thinking what Kimberly read, I don't know that we're gonna be much different than that
Yeah.
in this, and so I think
So we
that's
could
great.
share it with the other board members who maybe didn't have access to that previously, because I have all of that talking.
Right, so maybe we could create ad hoc and say, you'll share that with them, and then they come back with a suggested, here are the things we want to do. Which ones do we feel like we need an ad hoc to create? So like housing, so probably need an ad hoc. Other things we won't need an ad hoc. And
I'm just thinking, because I spend a lot of time as an educator, there's gotta be a tool to allow a group to kind of rank that list prior to a meeting, rather than kind of trying to talk through like what's most important, like maybe perhaps an ad hoc meeting is coming up with just this survey for us to take and expedite that process. I just kind of like, if one of them is housing, that's pretty broad, and then leaves a lot up to the committee I worry about the broad topic and the specific topic, and like the leak that can happen there, and the loss of people and interest in that.
Right.
You know what I mean?
Yeah, and I think the challenge we have, and it's not a bad one, is just that there are people we would all love to know information about things. And then we have a responsibility to make recommendations. And we only have 10 meetings. And so, right, so even if we rank them, we would just have to be clear, what are we ranking? Like, are we saying, okay, here are the 4 things, and we're going to focus on these this year. And the rest are, if we have time, we'll fill some information in. But I think it would make sense if that's what you're saying, like, because otherwise we're just going to still be in this. Yeah,
Otherwise, I mean, what I'm hearing is that the list always is longer than the time.
correct.
But so if we have like a rank of like, this is the most important, at least this gives us some kind of like, making sure that we're not,
And I think defining what most important is, I don't need to be.
or most
Like,
of interest to the group. or
Yeah,
What's
because-
most desired by the group.
right, there's interest and then there's things that we need to, our
Are
business,
mandatory,
right? Yeah,
right,
so
right.
I'm trying to be not so directed, but I think, there's a lot of things that we'd love information on, but it isn't information that will help drive us any recommendations or considerations, right? And so that's where I'm trying to balance. So, if we said, let's do this, if we have 10 meetings, we send out the rankings and then we say, okay, we're gonna do 7 for business, and we're gonna leave 2 slots open for areas of interest that may or may not be something that we would use in our, to help us understand, like budget. We also spent a lot of time this year, a lot of feedback from board members as we want to understand the budget process. And so Tony did a great job of really helping us understand. So now that we have that, now what else would we like to know? So I think there is, I don't know if we can do SurveyMonkey, or I'm sure Google Docs has something. We could send out and rank it. I don't know if can we do that with respect to Brown Act?
Oh,
I think it can come from me if you guys have an idea of how you want it to be built. I could build that for you based off some of the topics we already have designs. That is essentially what Brittany did when she was here.
Right.
We circled what's the most.
But it was at a
popular
meeting
for.
So it was in a public forum
Yeah.
versus us determining,
Yeah.
yeah. Just want to make sure.
I just think you would have to create a list, so someone's gonna have to create a
I think
list.
we'll
If
just
you're not
go
doing
ahead
it
and
together.
Yeah.
It would need to be something you discussed as a board, and we sort of started writing them all out.
I think the list I read off was something that was discussed in a
Yeah,
way
it's
prior.
in meeting, it's in a minutes way back a couple of years ago.
yeah, I'm just wondering if the process of doing the
Has to
survey.
be transparent,
is- I mean, that is almost like holding a meeting out offline.
I think there's a way you could do something like that in your time here.
Oh, okay.
Like you go to some of these, community engagement events, and so there's a QR code, you scan it and you rank things and the results are popping up on the screen. You know what I'm saying? So I think there's a way to,
So you
Come up
can
with-
create the QR code, because that's not my
I'm-
skill set.
I'm saying, I think that
You wanna
there
do it?
are,
Okay, thank you.
I think that there
As a
are,
high school teacher, I had to.
Okay, so that's a good idea. So we'll
Class.
do that next meeting. We'll have a QR code and we'll do the ranking. And then we'll share those results, so it's done in a setting.
All I need is, make sure it's clearly and deliver that list of.
Yeah,
Just cross out the cooperative.
okay, yeah, that's the whole, sorry, 26, you
I
have.
was gonna ask, on this list or any of these interests or these topic areas, are these new? Are they completely new to the board?
No.
Or would any of them be revisited?
Have they been with you before? Have there been speakers who've come and spoken on these topics before?
Yeah, but I don't like crisis now, crisis services 5150. There's so many things that keep changing that it's just because they did it once didn't mean that they would want to know.
So like a long time ago, and maybe it's
Okay.
the same program now that it was then.
Yeah, it's just kind of like community topics that have been brought up by members of the board, have been brought up in presentations, been brought up by members of the public. And then a lot of this was like talked about in the annual report as well.
Yeah.
But then this list is kind of, this was from our brainstorming list for the annual report way back. But I think a lot of it overlaps with like the presentation topics list that we had. I can dig further to make sure I'm getting the topics correct, but I think that summarizes most of it.
Yeah, and I think we could also, if we had this list, I'm just envisioning, say, 3 months from now, something else comes up and the board says, we really want to talk about X, it's not written in stone, and we might say, okay, what are we going to take off that list? So we can replace X instead. And so I think the envision would be that the board it'd be much more transparent in why we made decisions to have certain people come present or not, or what topics we've asked Tony information on. So that's kind of what we were thinking. So it would be fine if we talked about it year after year. It would be okay.
So is there any reason that this board and the people who are here today as a forum couldn't approve that list as a start off to send out to all the members of the board?
We can't send it out. That's what we're talking about. We need to have it in a public forum for the Brown Act. So we have to do it at a meeting so that it's transparent. I think that's where we're talking about the QR code, right? So we could do it.
Or at a meeting?
Well,
Oh, you can
I
just do
think,
it right now.
getting to your point, we could start that list and
Yeah.
table it until next.
Yeah, I think to be fair, we have a fair amount of people not here today. And so I do think just to make sure, I think to let people know
Right, but that's what I was saying, that we would do that, and then we would let those people know, and then we could get that feedback for the next meeting. Why can't we start?
I guess I'm not understanding. We can't work as a committee offline. That's not, from the Brown Act, you cannot do that.
What she's saying is let's start the work for say, 5 minutes now to go over that list.
When you said let them know, send it to them, that's where I'm confusing. It may just be languaging. I'm just saying, if they're not here, we can't group them in.
We can send it, oh, sorry.
We can send it out in the form of the minutes and kind of notify them to look at this, make sure you review this part of the minutes because it's going to cover the planning ideas that were discussed at this.
We can do that, yeah.
Well, it doesn't
But they
have to be
should
part of the
be-
minutes. We can send the information out. The problem is with gathering.
Yeah.
Taking it back in.
Okay.
So these are the topics that are recommended at this meeting. And then at the next meeting, we find if there's any additional topics, or we say we're gonna vote on whether or not these are the topics that we'll try to address
Well,
in the coming year.
I think we can vote on it. The challenge is the prioritization, but really, that's the bigger issue.
And we haven't gotten to the list yet.
Well, we have a list. We have a list.
No,
And if we want to add to that, that's
I
fine.
think we're all on the same page.
Yeah.
I totally
Yeah.
agree. I think it's just the language, but yeah, I think what we're talking about now is starting the list in public forum so that we're in compliance with
Correct.
that.
Yes.
Table and getting whatever it is in the minutes with the understanding that that list can be added onto it next meeting.
Mhm.
And then we'll add on to that meeting and I'll be on my laptop making that.
And you let us
little poll.
prioritize the
And then,
next
and
meeting.
then,
Yes.
at that next meeting also, I'll say, okay, here's the QR code, everybody, put in your priorities, right?
Right.
Just everybody bring a smartphone and don't make it hard.
Yeah, the prioritization, I think, and we can certainly send it out to them, say, we are going to prioritize next meeting, right? So if you're not going to be here, right?
Well, that's my concern because you said one of the reasons to not do it now is because we have so few people, but as I mentioned at the last meeting, it's the July meeting that we've had to cancel in the past because we didn't have enough people, everybody's out of town.
But we just,
So,
we could have,
okay.
I don't know, I guess because.
Yeah, I mean, I know that
yeah,
everybody
it's gonna be-
agreed to this.
It's fine, because we just need to make a solution. So I think, Kingsley, I
Okay.
appreciate your offer. I think it's great, Michelle, I understand what you're trying to say. As long as we can do it in a transparent way, so we're in compliance with Brown Act, the process, it's whatever you guys want. We just need to be compliant.
If we have the new attendance process with remote participation, although maybe they can't participate as part of the quorum, if people on vacation have their laptop, they can still do this meeting, give feedback on the topics for discussion, but they just can't vote on that.
Yeah, and I also think, Christina, you can send out and you can send out to everybody, here are all of the topics that have come up in the past. These are what we're going to be voting on. Please come prepared if there's things here you see that you want to add, because Kingsley can add them and then we can add them in and prioritize, right?
Yeah, I think it's really important that we send out that list because we have 5
Yeah.
new members
Right.
that have never seen the list. We
Right.
need to see it. And then also you want to have board input because what if there is a topic that they want to share? We're going to need to include that. That's why I think it's really important, like Michelle's saying, is we could start the process right now because everyone is here. To start your list, you can review the list that you have, you can get it going, and then we can put it all in one document. And if the board has any additions they want to make, they definitely can email me and we can include it. And then you can share that with the rest of the public, and it can be something you add to.
Yeah, so I'm fine with that, as long as I think we're gonna need to move this to the end, because what I don't wanna have happen is that I have a feeling this is gonna take a while, which is great, but I wanna make sure we get through our agenda.
Yeah, there's no problem. I mean, you can also just put it on the agenda for the next meeting
Yeah.
too, when you have your new board officers taking over.
Yes.
I mean, because that might be a good idea also.
Yeah, so there's many things we can do. But I think we can revisit it at the end, especially if we have, because we're supposed to talk about the agenda plan anyway, so if we could push this conversation to the end, and if we have time, we can certainly give the list, and if people want to add to it. So that Kingsley can add to it, and then other people can come July and they can add to the list if it's not there, and we can prioritize. Because it's about the prioritization that is a real issue.
Can I ask a quick question before we move on? Kingsley, with the program that you're using, are you able to edit it easily in real time or do you have to do it?
Yeah, as long as I have Wi-Fi, that will be it.
Okay.
So if I have a internet connection here, we're good. If not, then
Yeah,
It's all great, yeah.
Okay.
bring us in, yeah. Because we had that back then, we could have prioritized it. It's just, there's a lot of discussion around this and I want to make sure we give it the time it's due. So, and also Tony decided last month and he has a lot of updates, so I want to make sure we get some time. So, okay, so there was that. Yeah, I was just thinking of the ad hoc and I'll wait to do that at the end. So member announcements?
Yeah, we wanted, oh,
Got one. This Saturday, June 6th, in West Sacramento, there is a Fighting Fentanyl event from 10 a.m. to 1 p.m. The Opioid Coalition will have a table there. So we'll have Narcan and test strips and other treatment information. And also some prizes. I'll have a wheel, t-shirts. I'm getting rid of that big bag of Halloween candy that I don't want to eat. So for any of the kids that are there, or some of the adults that like that. So I encourage everyone to come out. There's if you like fixed up cars, there'll be a lot of cars there. There's some great food, so hopefully people show up.
Where's this gonna be at?
It will be at 1322 Anna Street, and it's at a church.
Yeah.
The Holy Cross Parish, 1321 Anna Street, West Sacramento. I went to the one last year. It was I'm not a loud music person, so the food was great, so was the company. I got to have lunch with a motorcycle group, been through treatment. I shouldn't say biker gang, this club.
What's the event called?
It's Fighting Fentanyl.
Who's organizing it? Who's
Ricky Brazil and some other individuals in West Sacramento. His son died from a fentanyl overdose a number of years ago. I think this is the 4th annual one that has happened. I see a lot of parents getting engaged in this because fentanyl is found in a number of other drugs, cocaine, methamphetamine, even marijuana. And people don't know they're getting fentanyl. And so when they use those drugs thinking they're getting one thing, they're overdosing and passing away. And so it's been an ongoing problem for a while.
Jonathan, did you have something?
I did. So I looked at SB 707 with respect to the quorum. The quorum, to have a quorum, it has to be comprised of members in the county.
Mhm.
But if you're participating outside of the county, you cannot be part of that quorum, but you can participate as a
Correct.
board member.
Yeah, you can participate, we can't vote, right?
You can vote.
Well,
You can vote. You just can't make a full quorum. You can be a full participating member, but if the quorum is how many?
1/2.
Which is what?
9.
9. And if 8 are in the county and I'm in Las Vegas and I want to participate, I could participate, but we wouldn't have a quorum because I would be the 9th.
but you can vote.
Well, we'd
If
have
we
to have
had a quorum,
If you had
you
a
could vote.
quorum, I could vote. Correct.
Okay,
If we had
thank
a
you.
quorum, I could vote.
Thank you. I need to train and explain something. Understand that quorum versus, okay. All right, thank you for that clarification.
and I'd like to report on the site visit. Site visit.
Oh, that's awesome, yeah.
Okay, so, as you all know, we had the site visit from the state into how Yolo County handles Careport, and Chris and Jennifer and I represent the local behavioral health board there. County staff did a fantastic job of putting on this site visit. They started at the courthouse, we were able to attend that part. We came for the presentation that Julie, I'm gonna mispronounce her last name, Freitas or Freitas? Freitas, ooh, I completely missed it. Okay, she put on a great presentation. There was a lot of discussion. While we were listening to her presentation, the California Secretary of Health and Human Services walked in the room and she joined us for the rest of the day. So that was nice. It was a really good talk. And then we went over to the tiny homes and to Walter's house for our tour. For the most part, it was very positive. They seemed impressed by what they saw in Yolo County, but they made a point of talking about how understaffed we are. And even when we were waiting to go over to the tiny homes, I talked to the woman, I don't know her name, but she seemed to be kind of heading up the team. And I asked her, oh, when you're looking at other counties, are you seeing pretty much the same challenges in all the counties? And she said, well, for the most part, but I'm very concerned about the understaffing in the county. So to me, that sort of sounded like validation, because we're always talking about how understaffed our county staff are, but to see somebody who's been talking to other counties say that she's very concerned, it changes things when it's coming from outside. So they did a fantastic job, but that was sort of the takeaway of it. And I know that they were talking about working with Tony to see if there's some ways to increase Medi-Cal reimbursements or to access some of the housing funds that we haven't been accessing in the past. But we do have a staffing problem here. Did you want to add?
Just for clarification, when you say understaffed, are you talking about insufficient mental health professionals, insufficient housing assistance folks, administrative staff? What specifically were they?
I should probably defer to Tony, but
then we were
the
understaffed.
specifics about it.
My impression is they were talking about case managers and clinicians to actually be hands-on, engage the population that needs that assistance. I think one of the reasons why we're understaffed in this county is that Yellow County has the second worst property tax percentage for revenue. So this county's revenue is below most other counties, making it difficult to fund all of the departments with general fund dollars.
But pretty much it was care.
Well, they were focusing on CarePort, so yes, they were looking at. But also, we've only got, what, a third of a person handling.
Yeah.
You're looking like I got something a little bit
Whenever you're
wrong.
ready, whenever you're ready.
Yeah.
I mean, you know, and I'll just be. Maybe not. But I will be transparent, but I will be transparent as Tony Kildare, our health director, whose opinions may not reflect the opinions of Yolo County. Let me just be clear about that. I mean, I think that there's a confluence of factors that might be into the situation we're in. And it is just in terms of different attitudes about fiscal management that have come and gone with previous administrations with the Health and Human Services Agency and the board. There was a lot of ARPA money that was in the county, like during COVID, right? And so there was a lot of different programs that were stood up and expanded upon and so on and so forth. I think that, so there's that part. And then there's the, what is happening in the world right now currently. I mean, you just see the impacts of HR1. You see the just, you know, and I'm always saying, you know, I've been to the supermarket and the gas station recently, right? There's just costs are outpacing income, and the county is no different, right? You know, the cost for the county to do business is outpacing their ability to generate revenue. To Chris's point, there is, you know, something there about the position that the county has historically taken with respect to poverty and allowing revenue to be diverted to the cities versus the county. All that to say, Chris is absolutely right. The county is continuing to experience some significant budget challenges. There will be a board meeting next Tuesday, June 9th, where there will be some discussions about that. I was taking a quick peek at some of the materials from that just a few moments ago. And I mean, just to give an example of some of the drastic measures that are being taken to address some of the budget shortfalls includes like eliminating 124 vacant positions, right? And there's other filled positions that are talked about being eliminated, right? And other remedies. And it's not just about staffing. There's other things that the county is doing to try to address some of that. On the behavioral health side, we probably recall me a few months ago speaking about a structural deficit in behavioral health that was somewhere in the neighborhood of $4 million, right? And so we've been holding positions vacant in anticipation of this challenges with this next fiscal year. And it's made it extremely difficult, right, to fill positions. Like we're holding the positions vacant because we know we have a structural deficit. So all that kind of culminates with this trip from the state, which it was related to the county's, and I'm going to do funny here, like performance on CarePort, right, which was some again, the opinions of Tony Ford are made up metric by the governor, right? That may or may not have had accurate data. Regardless, we only have one staff who's working on Cook, right? And
Wait, one staff or a third of a staff?
I mean, it is a person, but it's 1/3 of her time, right?
Okay,
That is dedicated.
Right, no, I didn't actually think. It was
Yeah,
just
and
like-
so, and it's not just in Fairport, right? It's across the board, right? And so, we are just trying to get through this budget process currently. Where we're at is that I had been holding positions vacant the past year, for the most part, except for trying to staff up for FSP, which we've been authorized to do. But now we have hit a critical threshold where I'm not holding the position, so we've had attrition, right? And we just have held the positions vacant. And now when we're having people leave, we're working to fill the positions quickly. But we're at like the bare minimum, like, and it's we're at the limit.
Hey, Tony, can I ask you a question?
Yeah.
Remind me, I can't remember. Is there a funding stream when the CARE Act statute to fund positions, or does that all have to come from?
So there is some funding that comes through the CARE Act that's more for administrative purposes, right? So there's like a really significant amount of data that is collected for CARE, right? So if you look at each individual client that's being served, they're like on a spreadsheet, and it was a row for each client. I think there's something like 150 data fields that they want reported out, right? So it's like a pretty significant administrative burden. And we'll be drawing down those funds. And there's, I think, an assumption in the conversation we had, like, you should be doing all this Medi-Cal billing to generate the revenue, right? And it's yes, but we also just don't have the positions, right? And everything's kind of connected with the other budget shortfalls that we have when we're not filling the position. So again, we're just trying to get through this budget cycle. What I can say is that there have definitely been some conversations that are escalating about the need to develop a solution to get some additional staffing, right? Because we cannot achieve the mission of the agency with the current level of staffing that we have. It's just not possible, right? So.
The key for Care Court is that it's an entry point for services, but you have to have the staff to provide the services, and that staff, there's an extreme shortfall in that staff available to provide those services with budgetary challenges.
Yeah, I mean.
So, sorry, I'm
Go
gonna
ahead,
interject
Lucy.
because it's just interesting timing, and I know Jonathan knows about this because he was also, so we, I've experienced firsthand just what Sacramento County did for a family this week and how Care Court prevented, a young man who was in psychosis, who had been held for many days in a hospital in Sacramento and was going to be discharged to a shelter, who was still psychotic, was still suffering from psychosis. He was not taking meds. They can't make him take his meds. And Sacramento County, the family petitioned Care Court. And based on that, there was a court order, and that hospital could not discharge him to the street. Basically, shelter street, because he wasn't going to stay there, not even know how he was going to get there. And this gentleman had already been discharged from another hospital and was missing for almost 2 weeks. So I think there's pieces of it that require, clinicians. But I think the piece that my aha, and I've also experienced this from someone in Orange County and San Diego County, is that we have a vulnerable population that if families knew about this and could petition, they could prevent maybe their loved one being discharged inappropriately. And I think that's something that was a big aha for me. So I appreciate Tony, like there's that whole staffing, but those folks are not going to be treated. Those patients are not going to be treated by the county. They need a hospitalization. They need a bed. And that is a piece that we miss. And those unfortunate families and patients just continue to get discharged and back and discharged and back. And so I just feel like that was not an aha for me. And maybe that was just, I wasn't catching on, but there's all different degrees of Care Court what they can petition to and what services they might need. But I do think the most vulnerable population definitely benefits from the family being able to petition, especially when they're being held.
I'm just gonna put out there, aside from all that, which, yes, long term, like for Yolo County to correct what's happening with the behavioral health system of care, we need to hospitalize less people. Right? I mean, that is where a significant amount of our budget is going, is in the hospital. And I'm not saying we
Understood,
should.
but you gotta
Hey,
start somewhere.
No, but what I'm saying,
People being discharged to the street.
I'm not saying that what I'm saying is not on a case by case basis that a person doesn't need to be hospitalized, right? And I'm not saying that people don't need to be hospitalized, they do. We are, with all the money that we have, if we could somehow or another prevent people from being hospitalized and put them into upstream interventions to prevent people from being hospitalized in the first place, that would be more cost effective. And
Totally agree. I'm
and-
just saying that I think we have for care court, if you only have a third of a person,
I know.
right, then you have families who petition even for the most vulnerable population who may not even get, they will fall through the cracks. So I get you have a whole piece that you have to staff for all these, for a whole continuum of care, but I also want to remind folks that this is a safety net for a lot of families.
But he has a third of a body doing the admin piece that's funded, correct me if I'm wrong. You have, for the treatment, like Chris was talking, for the treatment, you don't just have a third of a person if someone's in care act. You're talking about that funding you just mentioned only funds on the admin piece with those big spreadsheets, 1/3 of a person to do the admin piece.
No, the what we're talking about is we have a third of a clinician who is the one who's doing the actual work, right? So that the admin piece is not included in that third of a person.
And I knew not going to do a third of a person, that's really.
Yeah.
I get it.
Yeah, I guess what I'm trying to say is what this community currently is, if the system of care that has emerged, right, in this community is that hospitalization is a big part of the treatment, right? And that's where a lot of the money is going, is to hospitalization, right? And so, like, when we're talking about staffing challenges and trying to develop additional resources for people that need them, I have to find a way to reduce hospitalization so I can free up that money, right? Because one of the dilemmas with hospitalization, to be honest with you, is, there's a lockout for individuals that are age 22 to 54, right? And it's an IMD exclusion. We cannot bill Medi-Cal for those individuals, so we're just paying the money out, right? And so
You're talking about IMD. IMD is just a small little fraction of hospitalizations. Nearly all the people that are hospitalized are not going to an IMD. Like when you're talking about, or are they? Is center site considered an IMD?
yes,
Okay,
so
I take that back.
yeah. No worries.
Well, and I appreciate that. My only
That's
point for bringing that up is not
Yeah.
to debate.
Oh, no,
I understand that. I understand what you're saying. My whole point is that it was an aha for me.
Yeah.
Because we have families who come here and share their stories, that they have a loved one missing. They have someone who's in psychosis and they can't find. And they're missing. And then they get found and they're put in a hospital. They go to an ER. And there's not a bed for them. There's no treatment for them. And they're discharged back to the street and the cycle starts all over again. And it was how I saw the care court, that process saved potentially this young man's life by not having him discharged. I get that it's not the ideal solution, to Tony's point, but I think that was a big aha for me. And in Sacramento County, they have more resources, they're larger, all of those things. I'm not saying we can duplicate what they have, but I do think it could potentially save the young man's, which was to me a big aha for how we don't really understand all of the dynamics maybe with care court.
And I think, what Tony's saying, and I think we all agree here, we don't want the person to get to that point. But but when they get to that point, they need to be hospitalized. And many of us have worked with people or had family members like that with the frustrations where we finally get the police to 5150 them, they meet criteria, they go to the ED, the ED says they don't meet criteria, they're released. But the problem is the system does a horrible job upstream. And I'm not blaming HGC and it's the resource issue and all that. That's what's so challenging is, how do we get that, all that upstream work and the situations that Meg's talking about, and I know you're saying the same thing.
I agree with you.
Yeah, because if you get, obviously, if we didn't have people being 50 that would really be a great solution. And I know that would warm.
I mean, I think just from a pure numbers point of view, any dollar that we don't spend on hospitalization is a dollar that we could potentially leverage to hold down federal dollars to Medicaid bill.
Right, and then.
Now, it's not guaranteed, right? But
Yeah, it's just, I was just making a comment, an observation that, and I'm not here to debate, I get what you're saying, Cohen, totally understand, but I do think.
Sorry, I wasn't, let me just be clear. I wasn't trying to respond directly to that comment. I was just like making a broader statement because we were talking about 1/3 of the
Resources,
FTE
yeah.
and stuff, so I apologize if it came across that way.
Yeah, no, but I think that there's so much opportunity within care court, and what I hear is that because families petition, but if the loved one won't take their meds, they can't force them to take their meds, right? Because they're not an LP conservatorship, right? And so that is why there's some hesitation to even, for families to even engage care court. And so I think we just have to set some information straight on our county of, when care court might really be appropriate. And the fact that a judge issued an order saying this person is gravely disabled and you cannot discharge them, it had nothing to do with whether they were taking their meds or not. It had to do with the expanded definition of gravely disabled and it being enforced. So that was what was so amazing to me. Yeah.
I guess a clarifying question on care court and in the care court website. I haven't really seen a definitive answer on this. Do the petitions have to occur in the person's county of residence or where they're hospitalized?
Good question.
So for example, if someone is a Yolo County resident, but they're hospitalized in Sacramento, is the care court petition in Yolo or is it in Sacramento?
I think it's in the county of residence.
It would make sense.
That's what I thought too.
It's a question on the petition. Okay.
Oh, Richmond.
Yeah, but I mean, I think, it goes to, it's not a one size fits all, but we do have a vulnerable population, we do have folks in our community that, would have probably benefited if their families knew they could have a petition.
As far as outreach to families, I mean, NAMI does a great job with certain classes for families. I don't know, and the county gives NAMI money for certain things. And the question is, can NAMI create a class for training for how to do a petition in care court, how care court works?
We did a year ago here in this county, before I was working with this NAMI, we did like a town hall and about 40 families came. So we want to keep doing that. And I met with Julie Freitas and been trying to find a family story of what happened so I could write some articles as the NAMI director and get them out there. So there's all different ways we can do that. We do mention it in our family to family classes, which we have in the spring and fall. So yeah, I think we should keep pushing information out there for sure.
Yeah, especially because I think there's some potential misinformation out there.
Yeah.
Yeah. And so
it's complicated. Most family members don't know the restrictions, what the guidelines are.
Yeah, but I also think the expanded definition of gravely disabled
Yeah.
is also, whether you do care court or not, it's still holding community partners accountable for that definition.
And this says, generally, you must file the papers in the court in the county where the person you are filing for lives.
Yeah.
This is generally.
That said, it was a super interesting story you just mentioned of keeping somebody in the hospital because I had two moms called me today. If their sons and daughters were in their 40s, one here and one in another county that were released at 2 a.m. from the jails. So I don't know if there's,
Yeah, I mean, that is the challenge, the rinse and, repeat.
So I just want to understand with care court that it's not only about hospitalization. So that if you get a finding in care court that what you need is a lower level of care, but you need that care.
Yeah, she's just saying that care court.
Well, I'm just asking,
yes,
they can make that determination to Tony's point. So, but Tony, what you're saying is we don't have in this county that lower level of care staffing even if care court were to find that, yes, this person should go through the care court process, but not at a hospitalized level.
But then, yeah.
If I could, we have Safe Harbor, which is a crisis facility for up to 30 days. Encourage everyone to read the site visit report on Safe Harbor now to understand what that facility does in Yolo County. It could be a location where someone goes to that don't meet the criteria for 5150, or it can discharge from a hospital into that facility, further stabilization and treatment. So that's, we do have a facility like that.
And that's something care court could make a determination on if they were in violation.
They would have to be assessed by that facility to make sure they're appropriate for it.
Right.
I think that's fairly quick and that we should take most people, is the impression that I got.
Well,
But that's
Yeah, I
a
think,
different conversation.
I think maybe Tony could present on this at another time. I think that what I hear in the community is that care court doesn't think because they can't make a family member take medication. They cannot do that.
There's very little teeth.
Right, there's very little teeth
Yeah.
to it, and so what I think happens is that there's some confusion over when it's appropriate to use it or not, and Tony could probably speak more to that, but, because if you can't, you can have them go to a shelter, or have them go to Safe Harbor, but they can leave.
Well, I thought the alternative was you're in violation of the law and whatever the
No, that was
penalties
acute
of the
care.
law.
No, that was an ER, so that's acute care. Different. I'm not,
So-
it's different.
So with the care court, it's voluntary, right?
Yeah, it's
You know, so if a family member can file a petition, it's a civil matter, right? And individual can choose to participate or not, right? The idea really is supposed to be that it's an engagement process and kind of a pathway to get an individual into treatment, right? Where there are some different ideas about how it could potentially be effective is when sometimes we have individuals who have like a criminal charge,
Right.
right? And then the criminal court's making the referral, right? And there may be more incentives for someone to participate in care court, like as a mechanism to kind of have the criminal charges drop.
Yeah,
But-
mine is about in acute care.
No, I understand what you're saying, but the civil penalties are insufficient
There's
to
no-
be
There's no
a,
penalties, there's no
There is
penalties.
no penalty.
there's no
No,
penalty
there
at
is
all.
not.
We're trying to use the black rubber effect of a judge encouraging someone who's mentally ill to engage in treatment. You do that with limited success in the criminal courts with more coercive outcomes. But this has no negative outcome for non-participation or
Okay,
not showing up at.
Right.
So that it's all a voluntariness issue and encouraging someone to engage. That's what Safe Harbor is, in voluntariness, engagement,
but what I'm hearing is we don't have sufficient resources for them to engage. If for all the people, let's say they all willingly jumped into the boat and engaged, would you have the
Well,
resources to to provide for them?
No.
So in some ways, we
I
count
mean,
on people
I
not
will
following.
I will say we are definitely struggling to meet the demand for individuals who already
For even
are already receiving services. So I mean, I'm not saying we wouldn't or we can't, right? But what I am saying, we are definitely being challenged to provide services to everyone to whom is entitled, services are entitled.
I wonder if that means we shouldn't spread the word.
No, I would not say that either, right? Because I think that, I mean, that's like saying like we shouldn't spread the word that the county behavioral health is an entitlement program for people with special mental health services, right? The fact that we are, struggling to meet the demand doesn't mean that we should not let people know that services exist. I mean, we're challenged to find a way to make it work, right? Not to avoid our responsibility.
And I think there are, I don't know if this number still holds, but FSP, you have more people who meet criteria for FSP than you have spots.
We always will. I
Right,
mean,
you always will.
well,
So those folks
so
want treatment.
historically, that's been the case by a wide margin, right? In every county right now. I shouldn't say we always will because maybe there will be adequate funding for those types of programs at some point in the future. But I mean, Cal Mesa did an assessment and I believe that there was something to the neighborhood of like 540 individuals who roughly meet criteria and we have 100 spots. So
Hey, y'all, I just want to jump in and say this is an awful long conversation on something that has not been on the agenda. Like we're still in member updates, right? So I think it's very valuable conversation, but maybe back to your long range planning calendar conversation, maybe care court needs to be a future topic. But I just get nervous when you all start talking about solutions when it's not on the agenda.
It's on the agenda, but really we're taking it out of order. It's always
Okay.
it's always on Tony's mental health director's
Yeah.
report. So that's always
Okay,
there.
thanks. Okay, thank you. That makes me feel better.
But
Yeah,
I do appreciate you holding this test and
yeah, keep doing that. We need it.
we need that. 'Cause
We need
Well,
that.
I'll also say check out your time on the agenda because you're still not past the first part that said it would end at 7. And that,
But we're
Same.
just out of order because Tony was going to give an update on care court, but
that's
yeah. But I appreciate you keeping us on time. Thank you. All right, so correspondence. We don't have any correspondence from director. do we?
We actually did get our correspondence, but I found out because she emailed me looking for someone's email. So I included it because she said she had emailed all the board members separately. And I wasn't included in that. So I wanted to make sure that the public knew that we received correspondence from her also. It just didn't come in a normal manner because it went out to the board members separately.
Oh, if somebody writes to all of the board members separately, so we can the first.
Well, she wrote it to me and I had it tagged to it.
Did we do the minutes?
That's the only reason why I knew it existed.
Minutes, I just.
Yeah, we voted on it.
Yeah, we did. All right. So I guess, Tara, are you doing the board of supervisor update?
yes, I'll start and then Jack's gonna add. So I will be brief in light of the time, and frankly, Tony covered much of the substance of what we would cover because as you all can imagine, the most significant thing the board is facing right now is the board budget issue. So the budget hearing is next Tuesday. There's been multiple updates to the board over time. I think you all know that there is a structural deficit for the county's general fund, also a structural deficit within HHSA and also within the mental health budget. So this recommended budget has been developed in a period of significant fiscal uncertainty and economic constraint, starting from the federal level, coming all the way down. And while there are multiple budget balancing solutions that have been done, all the departments brought different options forward. There is, as Tony said, there is a proposal to eliminate 151 full-time positions. Thankfully, it's not 124 vacant positions are vacant, which is good, but that also means, there's less people impacted, but that also means the people that are remaining in staff have an additional strain on them. There are a total of 26 filled positions that have been identified for workforce reduction. This is less than what was presented at the past few board meetings because some alternative means of funding were identified or others subsequently became vacant. But we do acknowledge that with the reduction in the workforce, there will also be a reduction in the services. And then also the board has acknowledged that we cannot eliminate the structural deficit with cuts or revenue and with cuts alone. The final solution will also include some revenue enhancements, such as Tony mentioned, Medi-Cal billing. This is something that Supervisor Frericks and the others have talked about a lot. We know it takes time to build up that infrastructure. We do not have that right now, but that is going to be one of the key solutions for long-term stability. But I just wanted to add one more note. This isn't like behavioral health budget specific, but just to kind of continue to give the overall context. HR 1 changed, I think you may know, some of the administrative funding options. So for CalFresh alone, for the county to continue to keep the existing caseload enrolled, it's taking about an additional $1 million from our budget. So we have a structural budget deficit, but we're of course committed to funding that. So that just kind of gives you, to me, that was my aha moment of how constrained everything is and that we're plugging some of these gaps and there's even more to come. So that's not an uplifting update. But what I will say is that we appreciated Lou from Namiolo and Kathy and others coming to the board meeting at the end of May, where we did acknowledge May is Mental Health Month. So I appreciate that we're continuing to put mental health awareness on the forefront for the board and the community. So on that, note. Jack, do you have anything to add?
Yeah, I just wanted to add one thing. So currently there is a vacancy in the district attorney position with Jeff Reisig's retirement. And so the board has appointed Melinda Aiello as the acting DA in the meantime. And the board is looking at doing interviews for the position to appoint a full DA to fill the remainder of Jeff's term. And those interviews will take place on June 23rd. And yeah, more to come on that. So we're not sure on when one will actually be in place, but interviews are on the 23rd. And if you guys have any questions, then you can always call our office or Supervisor Ferricks's office. Yeah, thank you guys.
I just have a little clarification, and it's complicated, Jack, but the board did not appoint Melinda. The
By
chief
law,
deputy,
she's automatic.
the chief deputy.
Yeah, she's not appointed.
The chief deputy becomes the DA until the board appoints. Yeah, so I think you kind of just got confused a bit, but otherwise, that's a great report. Thank you.
So of course, Tony, I'm just gonna assume in your update, you'll talk about what it'll take the infrastructure to get the Medi-Cal up and running, because we've been hearing about that for a while. I know, so it's great that you might have the support you finally need to get that up and running. So,
Yeah.
if it's not part of your update, then
We can talk about it.
Okay,
Yeah.
It's now the time to ask about the board's response to our letter.
oh, right. Sure.
So we were just wondering, we had sent a letter to the board from this board, asking about whether or not the board would be interested in contacting our local state legislators about the concern about moving crisis transportation to optional instead of requirement because of the loss of Medicaid funding that would go along with that. And I was just wondering how that communication was received.
I do not have an update on that, but I will follow up with that to send that to the legislative subcommittee to see to work on that. So thank you for flagging that. I remember seeing that coming through, but there's no formal update from the board on that, but we'll follow up on that. Thank you.
Thank you. Report out on that next meeting then, Tara? As part of your, thank you. Okay, so we're gonna go back to public comment before we get to the next part of the agenda. So I'm gonna start with the folks online. Anybody have anything for public comment? Anybody in the
Chair Blankenship, I don't know when the appropriate time for public comment is on the follow-up on the housing. Is that later?
want to do it now? That's fine. Doesn't your public comments don't have to necessarily go in line with our agenda. We just sometimes do it easier. Yeah.
I don't want to keep you from your flow. I know you got a short time period.
Okay. Well, you can wait. It's up to you. You can, if you'd like to present, share now, or you can do it at the end. There'll be another option, another opportunity for public comment at the end.
Okay, well, I'll just go now. So Patria Marchand, obviously member of the Thompson Williams Mental Health Committee and working on housing issues pro bono as part of my firm's work. I just wanted to emphasize to the board, I know you're going to be discussing next steps with housing recommendations after your discussion last time later on in the meeting. And I wanted to emphasize the urgency of the board's work on this matter. As you know, there's $1 million that is currently proposed for capital improvements in the proposed 3-year plan for the 26-27 fiscal year. There's also $1 million for each of the future fiscal years, but I'm just going to tonight focus on that first fiscal year. If the county doesn't take action to complete physical needs assessments for existing homes by September 2026 or earlier, the county won't have the information it needs to commit funds by December. If it doesn't have this information by December, it won't be able to release an RFP to award funds for improvement before the new fiscal year starts. And secondly, if you don't recommend a new housing study or understand what type of housing and where it is needed, you're going to miss out on grant opportunities to create new housing. And I just really wanted to emphasize that every single day matters. I really was fascinated by your discussion about what the issues are. And Tony was saying that you can't provide the services that you want because of the high hospitalization costs. You heard last month about how many people have avoided hospitalization because they have stable housing. So I can't think of anything more urgent for both your structural budget deficit and for the people who are in our community who need this housing to do the work as quickly as possible so the county can actually spend those funds. So I just wanted to urge you to not only make recommendations related to housing as a board, but also to set a very clear timeline and ask Tony and his team to come back with regular updates so that you can make sure that money is spent as quickly as possible to try and reduce hospitalization costs and provide the kind of housing people need. So thank you so much.
All right, anybody else online? Or I should say virtual. Thank you. Anybody? All right.
Hi, my name is Christy Correa. I used to be Yolo County Local Mental Board committee member, and I'm here visiting. I currently work for DHCS in the QBHM Transformation Branch. I heard many conversations going back from, Nolan Sullivan about, budget, constraints, and here we are, they're happening. I heard Supervisor, I don't know which one exactly, but I think it's time to entertain the idea of proposing maybe a specialty tax, either sales tax. I know it's been floated before for Yolo County, but I think it's something that this board should seriously consider proposing to the Board of Supervisors, because I know the situation is dire and I'm hearing it, across the state, but it's scary what Yolo County is facing. And I think that, I know the general fund needs money, but I think specifically for behavioral health, for HHSA, there needs to be a solution outside of Medi-Cal, matching funding. And I don't see why it's not being seriously considered. So I would encourage this board to take a deep dive and propose that recommendation to the Board of Supervisors and looking at a possible budget solution for behavioral health services to fill some of these holes and gaps before the impact is even more detrimental to the community.
Okay. Tony, your update.
Okay.
Anybody want to pull?
Well, I apologize. It will be a verbal update. So I will provide you a menu, and then if there's anything else that you would like to consider, please let me know. So I was going to talk about the budget, even though Tara did an excellent job of providing an overall presentation and how the behavioral health specific part of it. I was going to talk about the Behavioral Health Services Act plan and provide an update about where we're at with that. Also, a brief update about Crisis Now. Update around the Adult Full Service Partnership staffing, and an update about current requests for proposals of their RFPs. I was going to talk about the CARE Act visit that we received from the state and provide an update about the children's system of care. I can go through any or all of those topics. So I'll defer to you, Care, about how you want to approach it. And again, I apologize for not having a written report available this month.
So we had CARE Act visit.
CARE Act visit, yeah. Okay, budget, BHSA plan, Crisis Now, FSP, staffing, RFPs, CARE Act visit, and children's system of care.
That's beautiful.
I can be succinct, right?
If we don't have an update, we should probably report briefly on all of them.
That's fine.
I mean, carefully.
That's
already been a discussion.
That's fine. Okay. So in terms of the budget, I think we've already had quite a bit of conversation about the but if there's a particular issue though that is coming up in terms of the governor's May revise. And so the governor's original budget had proposed to eliminate the mobile crisis response benefit as a defined benefit for Medi-Cal beneficiaries, right? And I believe we discussed this last time we were here, but the short version of it is that by requiring the counties to provide this, and the state is responsible to ensure that there's funding thereafter because of prosperity. And by making it optional, then the state does not have to provide funding for it anymore, right? And so that's going to create a significant reduction in revenues to support mobile crisis response. There was a lot of advocacy, hoping that the May revise would correct that, but it did not. So now we're kind of in a waiting game to see what happens, as there's still some lobbying that's happening with the legislature in terms of the budget. For us, it would potentially impact our ability to continue to provide mobile crisis response services after hours, right? So we already have a pretty well-established relationship with our law enforcement agencies, with the crisis co-responder team who provides the service during the business hours. But after hours, we've been working in an arrangement with the American Medical Response. We don't think that we're going to be able to afford to do that in the future. So that remains to be seen. That's pretty much, I think we've already covered all the other budget stuff. So I'll pause there if anyone wants to explore that topic any further.
Are co-responders more expensive than the American Medical Response? Is that what I?
American Medical Response is the contract we have with American Medical Response is more expensive than. Let me just start by saying they're great, right? Like the relationship that we've had with them it's great. It actually is a really good fit in terms of their ability to respond quickly. But we are just not able to generate enough revenue to justify that contract, right? And so, and part of the challenge really is that's even with the state covering the full bill, right? And so we can generate a lot of revenue when we for each individual response that we make now, but we're not going to when the program becomes optional and we have to cover more of the expense than what we currently do. It's going to become prohibitively expensive, right? And so,
I'm trying to understand why we wouldn't switch to having the co-responders around the clock. It's because they're more expensive.
Well, I don't think we would have adequate staffing to go around the clock with the co-responders, right?
She means more. She means
I mean,
more.
higher.
Co-responders of BHSA is mobile crisis BHSA.
Ask that one more time.
Co-responders are funded by DHSA.
Co-responders are funded by BHSA.
Are mobile crisis funded by DHSA? After hours.
Hold on. Let me return it. Our after hours crisis, the AMR contract is funded by BHSA. The mobile crisis responders are being funded by a variety of sources, but we're generating so much revenue with that because of the reimbursement rate that we currently get from the state, that we're not using a lot of BHSA for that particular program. Right. So we're getting some revenue from the cities, right? They're contributing a portion of the salaries, but we're really the way that the reimbursement rate, the way that the reimbursement is structured now is we can generate a lot of revenue, right? What has been happening over the course of the past couple of years is that most of the calls that we're responding to are happening during the daytime, and we're not receiving a lot of calls for service at night, right? And it's counterintuitive, I know, right? And there's a lot of different reasons for that, but for one reason or another, we're paying to have a service provider available 24 hours a day, 7 days a week. I'm sorry, on the evenings and weekends. And they're just not responding to enough calls to justify, right? So part of the challenge is that we really can't afford that without the revenue that the daytime community generates, right? If that makes sense.
Yeah.
So I'm not saying we will or won't do anything, but we're definitely concerned. We're trying to crunch numbers and see what it's gonna look like. It's gonna be just another budget challenge that we have to consider, right? This would go into effect if nothing changes. It would go into effect. It would become optional on April 1 of 2027.
Tony, I had these discussions many years ago, and I went and watched the county in Phoenix. I'm having a brain freeze on their program, and for crisis now, co-responders, and their team covered the whole county, which is a massive county, you know. And I pushed, and people weren't interested. Partly it was cities. Instead of having all these resources, and I'll just put this out there, and you know, instead of having all these resources, like one co-responder in each city, and they're sitting there for the most part and doing nothing, why don't we go back and start thinking about having a countywide team? And I realize it's a lot of mileage area to cover, but a countywide team that's on 24/7, rather than, you know, all these resources in every single city chopped up, and then the county area unincorporated also. So, and I know some of the chiefs didn't particularly like that idea because they feel they don't want other cops doing work outside in their city from another, you know, but I just think that that's something, I don't know if anyone has talked about that, that's something that should be at least explored.
Would it be other cops though, or would it just be the co-responder?
So usually if it's co-responder, the model is you have a cop and the co-responder.
Right, but couldn't the
Oh,
co-responder?
you're saying
live with
the co-responder,
Yeah.
well, yeah, well, I guess I can say, Tony can comment on this, but I guess the chiefs are very like, well, they do different things differently in West Sac. We want some oversight of our co-responder, whereas if Davis, I'm just throwing it out there, doesn't have their own co-responder, then it's a general co-responder, and it just gets a little complicated. And, you know, cities are different, so I get that. But I just feel like with everything that's going on here, and I know that a lot of times these co-responders are sitting around twiddling their thumbs, you know, until they get a call. And that's why, as you said, we can't have 24/7 because it's cost prohibitive because they don't get that many calls. But if we had less people doing it instead of 4 different cities doing it all at once and had one team, would that make sense? So,
Yeah, and so can we, just looking at time?
yeah,
We can-
Okay.
I'll put that out there, and that's for future
Thank you.
discussion.
I appreciate the suggestion. Thank you. So just in terms of, I'm gonna skip to crisis now. And I'll come back to the BHSA plan since it's relevant to this conversation, right? So, as I reported last month, we do have a contract with Well Space Health for the use of their crisis receiving behavioral health facility. So the CRBH, they call it the crib, right? And that is for us to have 3 chairs in their downtown Sacramento facility. And then right after we kind of got everything sorted out, then they had a flood there. And so the upstairs neighbor had some flooding that flooded out their whole facility, and they had to move temporarily to the South Sacramento location. So we have had a couple of people taken to the temporary facility, but while they've been doing repairs at the downtown facility. So it looks like they're going to be back in business in downtown on July 1, right? So that's when we'll have kind of everything in place for all of our partners to kind of make direct referrals there. It's a pilot project. Currently, you know, we're set for 1 year, but it was kind of like 1 year from the date that the contract started. So we're going to kind of be watching that as time goes. It does look like there is some potential flexibility. I mean, this is Sacramento County's project, and they were gracious enough to say they can use 3 beds. And I've had some informal conversations with their behavioral health director about, like, do we think that, like, do you think we might be able to, like, work out something like on case by case basis, right? If there's an empty bed, right? And it seems like they're kind of open to that idea, right? Because I think it would help them to create their own cost, right? So
I reduce hospitalization.
So, you know, we have had some, you know, a few individuals who have been brought to the alternative location. So we technically do have something in place, but it's gonna be a little bit more solid beginning July 1.
And then Tony, that would reduce hospitalizations potentially too.
That would reduce hospital, that's the whole idea, yeah, I mean, definitely the idea is for us to have like this whole the crisis now model, right, which is, the number they call, someone calls, so a crisis response team will go out, divert them from hospitals or to jail, right, get them to a receiving center, right, and then kind of do linkage from that point, right, to connect them to services. So we're also in the process of filling a position for a clinician who would be dedicated to that project specifically to make sure that they're coordinating discharges from the receiving center and making sure that they have linkage to other services upon discharge.
Okay, sorry about the flag.
No, yeah.
But thank you for doing that.
The Behavioral Health Services Act plan, as you all may recall, we had the 30-day public comment period that ended April 30th. We had the public hearing here at the local behavioral health board meeting on May 6th. We have submitted the plan to the state. It came back with some revisions that were necessary. We resubmitted it. There are just a couple of minor edits now that are necessary. And we're working through that, and we will be providing a presentation to the the Wheeler County Board of Supervisors on June 23rd. We had intended to try to present on June 9th, but we're just not quite ready for that yet. So we will be making a presentation on June 23rd to the final approval from the board to move forward with the plan.
I had a question.
Yeah.
You indicated the last meeting that under the operating subsidies, 1.2 million was going to go to fund Pine Tree Gardens. Do they meet the criteria for 50% chronically homeless? Have you done a survey to validate that?
No. I have not. I mean, so the first part of the question, I'm not sure. Second part of the question, we have not done a survey about that.
Okay,
that's a valid question, right?
so $500,000 that I understand we can track from one place to another if they meet that criteria, but that seems to be something that needs to be done.
Okay.
And then the other question I have is under the capital development, would it be helpful to have an ad hoc committee from this body to work to engage housing providers or identify housing in conjunction with the county? They try and come up with a recommendation of what to do with those funds for the board.
Are you posing a question, Chris?
A question, or I
it's a question for me or for the board?
I've got in ways for you, because we create an ad hoc committee and do all this work, and you're like, that doesn't help me at all. The board said it doesn't help, we're just wasting our time. But I do think that as far as the capital development funds, we need to make sure that all of the community-based organizations in the county are aware of this, understand what's, maybe give feedback as to how we establish priorities or criteria for it. When I was engaging with HPAC with the HUD funding, you had HPAC members evaluating proposals for that and making a recommendation. So a process like that might be helpful. But what I don't want to do is create an ad hoc committee and do a lot of work. Then it's not going to be fruitful.
Understood. So our intent is at the June 23rd board meeting is to, as part of the presentation, to make a recommendation to the board about developing a process to, like you're describing, like to engage the community and make a determination about how to expend funds. We're going to be asking for the board's direction, right, on what that process should look like, right, and go from there.
Okay, so one thing the board could direct is an ad hoc committee in conjunction with staff to engage entities in our communities
Wait, you're saying the board of supervisors direction though, right?
We're seeking,
This board.
that's what they,
Yeah.
right, exactly, right,
One
you
of
know,
the
so.
things the Board of Supervisors could do is direct. Well, I think we have to appoint an ad hoc committee technically. So it or direct. I don't know, however language you want to use, have that engagement option.
Yeah, so I mean, we're still working through some of the proposals, right? But like, I think what we want to do is give the board a couple of different options about how to proceed with that. But ultimately, we're seeking guidance from the board and direction from the board on how to develop that process. And I'm definitely sensitive to comments we've heard earlier about there being a sense of urgency with moving forward on certain parts of this, but we also want to make sure that we're engaging all relevant stakeholders in the process as well.
I think the one thing that an ad hoc committee could do is identify needs as far as sustaining existing properties that may need some maintenance to go forward successfully.
So I don't know that staff, right, can propose to the board to direct the local behavioral health board to develop a ad hoc, right? You know what I mean? You know, so for whatever it's worth, right? You know what I mean?
We have two staff members from the board here. I don't know if they have guidance or suggestions on that or what would be helpful.
My assumption would be that this board could choose to make a recommendation to the board of supervisors if it felt inclined.
When would it be helpful for us to do whatever recommendation we're doing? Where in the time?
I think that, so my opinion, right, is that if this board wants to give the board of supervisors input, right, in the past, the former chair would kind of receive input from the board and then author a letter saying this is what we're recommending.
But when would it be helpful?
Before the June 23rd meeting, right?
Oh,
You know, so like it would be very helpful to have something like that at that meeting.
Well,
Yeah.
which we knew, I mean, I think.
What I can do, what I can do, Chris, and members of the board, right, is as part of the presentation, I can make reference to this conversation if it would be helpful. That the local behavioral health board appears to have an interest in being involved in that process.
We can probably agree to that, right?
I mean, I think you could, I think, you know, that I think there's other folks who have interest, just given, I mean, we could just propose an ad hoc committee, not necessarily to make recommendations, but to just start understanding the housing, or we can wait until next meeting and prioritize it for the plan, the agenda planning. I just know that this is complex and there's lots of questions with the board.
So, right, and so my intent is to go to the board, say, please give us approval on the plan. Also, there's this piece of the plan that needs further engagement and conversation, right? And that seeking direction from the board about how to approach that, but with the idea being, okay, we're gonna take that part of the plan and do some more work and then come back to the board, right, with a proposal for that specific part of the plan.
So it sounds like us creating an ad hoc committee is not misaligned with what you're trying to do.
I wouldn't think it would be.
Yeah.
Yeah.
Okay.
So can I suggest we create an ad hoc committee to explore housing needs, focusing on capital development from the BHSA?
And maybe future housing needs.
In future, there's, when you read this brilliant report on the site visit, you'll see one of their challenges placing people out of that institute into adequate housing.
Right.
So there's housing. If you look at people who complete Walter's house after 90 days and are successful, where do they go after that? So there's a wide, varied, housing needs.
So would you be willing to share that,
I
or?
was
is there
going to
something-
suggest Kingsley, but I will be happy to be on that ad hoc committee.
So I thank you and I appreciate kind of like the soft heads up that I got when this might be coming. So I guess like, just because I'm new, fairly new and still finding my feet here. I just don't want to overcommit myself and kind of like, leave myself short on anything. So I guess like, what would be the expected commitment and kind of what is the product look like that we'd be trying to go forward here?
Is anyone else interested in this topic as far as participating in an ad hoc committee?
Can I make a suggestion? If we're doing it about committee, we need to make sure it's geographically diverse.
Correct.
Yes.
Absolutely.
No. Just one.
Guys, this is a process question, because Chris and I talked a little bit about this. When you guys form an ad hoc committee, do other housing agencies, can they come into it, or how's that?
The ad hoc committee would probably work with Tony and to determine who they should reach out to. So yeah, partners would come into it. They wouldn't be part of the ad hoc committee, but they would be a part of information gathering. Does that answer?
Chris, what do you think about co-sharing?
I'll do that with you.
And then
I can volunteer for that. We do need to get,
I know Melanie would be interested, but she's also, I know Melanie might be interested. Kenya, yes, awesome, thank you.
interesting.
Lauren, awesome, thank you. Okay, so there you go.
Okay.
Thank you.
So
All right.
next steps will be,
We would need to meet and kind of come up with a plan, working with Tony for engagement.
Yeah, and you know.
We might get some guidance on June 24th.
so
Again, I'll, as a caveat, that if the board is directing me to do that.
The board of supervisors?
Yeah, if the board is
Who's directing
supervisor to engage with this.
I think you would engage with the ad hoc anyway.
Yeah, I can engage with the ad hoc,
To the board or not.
So I mean, again, I think it's really going to depend on what the board directs in terms of the approach to this.
Well, the beauty of this is they can change, it's more information. for
Yeah.
23rd, and I'm not here in July, but when you guys are looking at your working and planning, if things change, you can always make it, you can disband the ad hoc and create a different one. Choose two, but at least you guys have some time to putting all these thoughts together. Because there's a lot of discussion, so.
okay, so I got that this is Chris, Juan, Kenya, myself, and Tony.
Well, the ad hoc means us four. Tony would be a an advisor.
Tony's an advisor, okay,
Want to contact for information.
got it, as far as, okay.
And Christine, I don't know if we have an updated phone list and emails for everyone.
I can send it out to her.
Thank you.
Thank you. All right, thank you, Tony. What
Yeah.
else? And then,
Okay, so, again, we'll see you on the 23rd. The, adult FSP program. We do have a manager. We do not have a clinical supervisor, so that position is vacant. We do have 2 clinicians. So both of the positions are filled. We do have 4 behavioral health case managers, and we have filled 1 of the 8 permanent supportive housing site case manager positions that were authorized by the board, right? So we just went through a round of interviews, made some offers. We actually have an internal staff who is also going to be transferring from a role into one of the supportive housing site case manager positions, and we're now looking through another batch of applicants to begin another interview process. We were working with housing partners to include them on interview panels, so that we're all on the line about the individual that we choose.
So how many of the 8 have been filled?
1, but it should actually be 2 because we have 1, but we have 1 that's coming. Right? One is filled currently, and we have 1 that is coming for sure from an internal transfer.
And then you're starting a new application process. So you didn't get enough people 3 months ago.
Well, we were working through a list, and now we have another batch of applicants that they're going through the whole process of ranking them and starting the process for beginning interview.
And these positions that have vacancies are not related at all to the
These
vacancies that are
positions-
frozen, they're paid for through the VHS.
These particular positions were specifically the board specifically said to fill these positions. And we put that.
So they're
Right,
not
yeah. So these positions are not subject to the reduction. Yeah. Sorry, that would have been much more.
No, thanks,
elegant answer.
I just
I apologize,
wanted
yeah,
to make
yeah.
sure it wasn't the same thing.
Yeah, these positions are not subject to the.
Okay.
Okay, we have multiple RFPs that we're currently working on. One is for after hours mobile crisis response, which I think that there's a big old asterisk around that right now, just because of the state budget. And then there's coordinated specialty care for first episode psychosis, which is a BHSA requirement. And one also, we're considering an RFP for individual placement and support, which is another BHSA requirement. Of course, when we're ready to move forward on an RFP, we'll be in contact with the board to request having a member to participate in evaluating the proposals.
What is that RFP topic?
After hours mobile crisis response, sorry, geez. Coordinated specialty care for first episode psychosis and individual placement and support.
Okay.
Yeah, so.
Some board members are more interested in that than others.
Yeah. So as we get closer to actually releasing RFPs, we'll be reaching out to you. One of the things that's slowing us up right now, and I think we talked about this before, is AB 339, which requires us to notify the unions whenever we're proposing to do work that could otherwise be performed by county staff, right? And so essentially, we are directing all of these requests to our human resources department, who's coordinating with the union, right? So there's like a delay. By the time we're ready to go, we have to wait like 60 days essentially to begin the RFP process. So we're kind of, and there's been some bottlenecks, so we're still working through it. It's a new process that went into effect January 1. We already had a little bit of a conversation, but I just want to follow up if anyone has any questions. As you may recall, Governor Newsom identified 10 California counties that were underperforming in terms of CARE Act petitions to the court. And that's debatable whether or not Yolo County was or was not underperforming, and I don't want to get into that conversation, but essentially the state Department of Health and Human Services offered these counties technical assistance, right? And so as part of that, they wanted to come and do a site visit. And so they visited several other counties, but we had a very large contingent that came to Yolo County because it's just across the causeway, right? So a little different than flying out to maybe some of the other counties. We had the Secretary Johnson from the Department of Health and Human Services. The Deputy Secretary was also here, and some of their staff. We had representation from the Judicial Council, and they're a consulting firm that they had. And I'm trying to remember, there was one other government agency that was present. Army State Hospitals, thank you. And they basically just wanted to come and see what was going on. So the first stop was at the court to actually observe a CARE Act hearing, have a conversation with Judge McAdam, who shared some opinions about this, including a recommendation that there was also, I apologize, there was also representation from the governor's office, right? And so basically, Judge McAdam was encouraging them to consider some sort of legislative approach to update the 5150 code to include providing information to the families or to the individual about the care court, and maybe sort of generating referrals through 5150s. From there, we came to help our Health and Human Services Agency office. I received a presentation that included information about local implementation and kind of question and answer session with our staff and the representatives from the state agencies. And then we went over and visited the tiny homes site at Eastwood. Generally speaking, I agree that the representatives from the state did have some concerns about some of the local limitations, particularly around staffing. They also have some different recommendations around ways that we may be able to better leverage Medi-Cal revenue to support the program. And so we're awaiting some technical assistance from the state, but essentially the idea was for them to just come out and get a look at what was going on here so they could better understand how Yolo County is going to take care of it.
Thank you for sending an invitation.
Yes,
Members, I really appreciate that.
I-
Because that was, everybody was very grateful for the opportunity.
I regret that it came late, so thank you for being, thank you all for being understanding and diplomatic about that. I really appreciate that. Okay, and then that leaves me with children's systemic care. I regret to inform everyone that our clinical manager who oversees our children's systemic care left the agency. So Dr. Mary Young, who had been working for Yolo County for almost a decade, and who was really very much involved with sort of transforming the children's systemic care into what it currently is. Just personal decision, right? You know, to leave the agency and just leaves us a big hole, right? And so we are temporarily, we've kind of moved that team under our adult access team, under the manager enabled access team, and we're trying to we're doing a recruitment for a clinical manager to see if we can find someone to fill that gap. But I mean, it's a pretty big loss, right, in terms of just institutional knowledge and just her ability to kind of operate the system of care the way she did. So other than that, we're working on all of the things that we're required to do. There's a number of evidence-based practices that we need to implement because of the Behavioral Health Services Act, including high fidelity wraparound, parent-child interaction therapy, as we already talked about, coordinated specialty care for first episode psychosis, right? So we're kind of actively working to meet those requirements with the remaining staff. Pause there. Any questions?
Thank you.
Fortunately, I know a guy who knows something about children and mental health.
I'm saying, you can talk to yourself,
Yeah.
Okay, all right, thank you, Tony. We're gonna, final public comment for the evening.
Hi, Christy Reagan. I just wanna, make sure this board, I know there's new members, there's a distinction about what Yolo County, currently has with their clinical, social workers embedded into the law enforcement, more of like a crisis intervention team Memphis model. What most counties utilize, including Sacramento County, are mobile crisis response teams, which are tied into 988, like your co-responders. But these mobile crisis response teams that most counties utilize are non-law enforcement. So only clinical teams that show up. They do work in parallel with law enforcement, but in theory, like Sacramento County, when you call 988, you meet the criteria, it's say the mobile crisis response team is dispatched, not law enforcement. So this county is operating differently. So maybe that's something that this board wants to look at, you know, which model would work best considering funding and other possible options for the future.
And we talked about that issue because that is the platinum model, not to initially have law enforcement go out because obviously that can be problematic and triggering.
Sounds like it's something you guys should run and
Can we go back to my item for a second?
Yeah.
Because we're not supposed to respond to public comment, right? So Karen, if we go back to my item, which item?
You're gonna respond to yourself then. Yes.
To the conversation about mobile crisis response as it relates to the governor's budget, right? I do appreciate the reminder, right? I was going to comment on this. I think that the designation of co-responder is like misleading, right? They're embedded in the law enforcement agencies, but they don't typically respond with law, right? Because not all of them, right? So the mobile crisis response benefit specifically prohibits one of the responders from being law enforcement, right? So it's like, it requires a licensed professional health, person, right? So someone who's a licensed member, they can participate in person or remotely, and one other person, right? So it can be a case manager, it could be another clinician, it could be a paramedic, it could be a peer worker. But law enforcement can't be the other part, right? Now, law enforcement can be there, right? They can be present, but there needs to be those two members in order for us to engage the benefit. And what we've been experiencing locally, much like other jurisdictions, that law enforcement really didn't want to go out on these calls anymore, right? They just don't, right? I mean, we've really, to an extreme, almost, like we've experienced some scenarios now where we're like, we need to put this person on a 5150 and like, we need your help. And they're like, nope. Right. And so, that's a whole other conversation to have. Right. But the local implementation really isn't meant to be like kind of this idea of like, you got a cop and a clinician in a car riding around together. They're just embedded with the law enforcement agencies. Sorry about that.
Thank you for that clarification.
Yeah.
Well, and it might be something.
I think that calling them co-responders, I think it might help for us to have a language change at some point in the future, but everyone seems to love that term.
Their salaries are paid for by part of the city law enforcement budget. So I'm just saying, like, maybe this board wants to think about a different model in the future.
Thank you. Thank you. Okay. Anybody online who had public comment before we? Okay, so found out after the agenda had been that we were moving the ad hoc report out both on the site tour, because we have two folks that were on the tour that aren't here, and then also Dee was in short notice. She's attending this West Sac City Council meeting tonight, so she's not here. So we were gonna defer those two. Sorry, Christine, I found out yesterday. So then we're just moving to Jonathan's ad hoc committee report.
Meg,
Yes.
sorry to interrupt you. Dee did ask me to get names of the people that are interested in the communications education ad hoc committee.
Okay, great. Michelle, first one, right?
Yeah, I already gave you my name, but
And
again,
and it's okay if I've already thought you might have been the other one, but it was, okay. Yeah. And if anybody else wants to join, they're welcome to, but
Thank you.
yeah, thank you. You too. Kimberly, it's.
I think it's enjoying the ad hoc.
Okay. Great,
Sorry,
all right,
thank
so I'm gonna turn to, thank you. I'm gonna turn over to Jonathan.
Thank you. So this is the slate for next year's officers. Our chair had asked me to lead this ad hoc committee. As all of you know, I corresponded with all of you to find out who was interested in being on this committee and also who was interested in serving as an officer. So my fellow members are Sue, Michelle, Dee, and Jennifer. And we all have agreed that our slate should be Meg continuing as our chair, Kimberly as our vice chair, and Chris as our secretary. So I'd like to make a motion that we approve that slate.
Second motion.
Holder.
Fine.
Favor?
I'm gonna abstain. I wasn't paying attention, sorry.
giving him the.
Oh, yeah, sorry. Yeah.
So we're gonna disband that ad hoc committee, Christina.
You got it.
And before we adjourn, I have this for Sue, thank you, because Sue has been vice chair for a while, right?
Well, vice secretary, secretary.
Yeah, thank you. And if you'd like to voice any Zoom, and smart with, and she's just a lovely person all around. So I'm gonna miss you as vice chair, but now I get to try your way a little. And I'm grateful that you're staying with us, and I'm grateful that Chris is choosing to join. So thank you.
When is that effective?
July 1st.
Oh, wow.
It's my last.
Yeah.
Sue's last
We're gonna
meeting,
miss
so I
you.
just wanted to say thank you.
Not my last meeting on the board. Just kidding, it's not this circuit.
Okay.
Yeah.
Good.
As far as we're on ad hoc committees, can I move to add a site visit ad hoc committee for CORE? It's located in West Sacramento. It's a drug treatment center. It does the methadone for the county. We're looking at medication assisted treatment.
So we would disband the Hope Cooperative one, and you'll start one for CORE.
That one for CORE. I don't think we disband the safe harbor until the
We'll start
report.
with Safe Harbor here. Okay,
So it should be next
next month.
month. I'm
Okay.
hoping everyone reads it.
They did a great job on the report. If you haven't read it, you know you got it late, but they did a great job. And then for agenda planning, I'm just gonna, so we'll basically go back to the ad hoc report out. So we'll have to, and you guys will report out on your site visit. And then, but I think the majority of the time will be spent really looking at the annual planning and how you put the prioritization of topics. You guys can agree on those topics, and then some prioritization. I think that's it for the agenda planning, and obviously Tony's report out. And anything else you'd like to add, Tony, to the agenda, other than the report out?
No.
Are you gonna appoint anyone to the site visit ad hoc for the core?
I am going to be the chair, and I will.
It will be Melanie and Dee. Yeah,
Melanie and Dee, okay.
Same folks.
But we are, okay. If someone else has particular interest in that, let me know. Okay.
Okay, thank you, everybody. Yes.
Is there a process for applying to participate virtually if you know that you're not gonna be, local?
I think just like Christina now, same process.
Okay,
Great
it's not-
Is it for work?
No, I'm just saying, if you know you're gonna be out of the area, but you can zoom in.
So there has to be, specific, like you can't just decide you're gonna be out of the area. It has to be either like on vacation or something. It has to be for work and business. Or another big thing here was disability,
Uh-huh.
right? So you might have someone who's, I don't know if this would count, but if you're older, you have some eye issues, you can't drive at night, when it gets dark, when it's dark, when we leave, things like that. But I don't think you can just kind of decide because you're on vacation or something that you want to participate as a voting member, but you could always participate if you want to just watch and you can make public comment, even if you're not participating as a board member. Does that make sense? It's pretty complicated.
I was gonna say, do we get a copy of the rules or something like that, so I can even
So-
understand how one.
I don't even understand it very well.
So the process is, just to go back, regardless of what we determine what you can and cannot do remotely, is to let Christina know, and Christina will let me know, or you can just include me in the email to let Christina know that you're unable to attend in person. And if you would like to attend virtually, please make a request. Until we get clarification from county council, the process is that I will just determine. We'll talk about it and determine what criteria you meet. Because some people might have a disability and they may not choose to share it publicly, and I want to be respectful of that. So if we could keep that process the same, and then to Jonathan's point, we're getting some clarification.
That's what I was saying, is,
Yes.
are there criteria that all the members can be told about so that we know
Yeah,
what it is
the
we're
way-
asking for?
Yeah,
I'll pull the legislation for you and make sure that it goes out. I'll check with you first before I send it out.
yeah, there is some wording in there, but it's still very ambiguous. I need an attorney to tell me because there's other circumstances. So there's like childcare, disability work, but there's also other circumstances. And so the other circumstance is what I was waiting for county council to give us
Okay.
direction on.
Okay.
And so, but I wanted to at least get the voting down and we could at least participate virtually and adopt those. So,
Okay.
more to come. And I apologize, I didn't reach out to county council soon enough. But, yeah. All right, meeting adjourned. Thanks.
Thank you. Tony, quick question. For the core contract, that's the latest. I'm just going to.
Yeah.
Site visit.
I think so, yeah. I think so.
Okay, I just wanted to-
Yeah.
Well, I contacted Tony said,